Lisa, thanks very much. Time for Ask Your Family Physician. Dr. Deem joins us from Christie Clinic. We've got a few viewer-submitted questions that we're going to dive into this morning. Dr. Sarah writes in and says, how prevalent is hypothyroidism, and what are the best steps to take to help?
Yeah, so hypothyroidism is a problem where you have an underactive thyroid gland. It's actually a pretty common problem worldwide. The most common cause worldwide is iodine deficiency. We really don't see that here in the United States because we have iodized salt, and that's in all of our food, and it's one of our best preservatives, so people get plenty of iodine here. Our most common cause here is usually autoimmune, where it's a Hashimoto's thyroiditis, where actually your body makes antibodies that attacks your thyroid gland, which sits in your neck here. Women are about 7 times more likely to get it than men because it's an autoimmune disease. The signs and symptoms can be widespread. The thyroid gland controls everything from heart rate to how fast your intestines move. So if it's abnormal, you can get constipation or diarrhea, muscle aches, mood problems. It even messes with women's menstrual cycles and can cause depression and anxiety. So the symptoms are far and wide. Thankfully, it's easy to treat. You just put people on thyroid hormone medication, and we usually put you on a dose, and it takes about 6 weeks for that dose to kick in, so we normally don't even repeat blood week until 6 weeks down the road, and it's just a matter of finding the right dose. So hopefully there's hope in sight besides just hurting. So.
Yeah, how do you identify that? Or how does someone identify that that's maybe what's going on to even address that with a physician?
Right, so they usually will come in with concerns of weight gain or weight loss, depending on if they're under or overactive. Anybody that comes in with depression or anxiety, I always check their thyroid level. It's just a blood test. Anybody that's coming in with GI complaints like constipation or diarrhea, I mean, any complaints at all could point to a thyroid problem. So I routinely try and fill everybody's thyroid, and I test for thyroid a lot, and it's very simple. I mean, it's just a blood test.
Right.
So.
All right, very good. Moving on, we've got a question from Beth. She says, I am having hip pain only when sleeping, depending on which side. What's up?
Yeah, hip pain's sometimes tricky to figure out, and it usually requires me to actually have to touch you. But usually if you have hip pain that's in the front or in the groin area, that's usually an arthritic problem, like where there's narrowing of the hip space. Usually the history there is it's worse after standing on it all day and worse with activity, and sometimes that can be confused with it hurts more at night, because at night when you're going down to bed, it's after you've been on your hip all day.
Sure.
The other thing that I think about, if you're having pain on the outside of the hip and it hurts when you're laying on it, that is usually more of a trochanteric bursitis problem, and that can usually be easily fixed with a steroid injection in the office. There's some muscles that all connect to the lower leg and the hip girdle, so IT band syndrome is one of them, but it usually requires somebody to take a look at it. So.
All right. One more question this morning from Brittany. Brittany asks, what can one do for energy through the day when you're sleep deprived from a baby?
That's a
common problem.
I've been there. Not as bad as my wife, but I've been there. So, if you're a stay-at-home mom, or if you're off work right now, we typically try to recommend, and the OB-GYNs recommend, when your baby's sleeping, you should be trying to sleep. You kind of got to work your schedule around them, because babies, when they're young, have to get up and eat up until a certain point, and so you're always on their schedule. If you don't have that luxury and you're back to work, there's not a lot that can be done outside of trying to get a good regular sleep cycle. Sometimes you have to depend on your partner to kind of help with some of the activities and responsibilities of the baby during the night, so you can share the workload. Caffeine always keeps people awake, but if you're breastfeeding, you want to be careful about how much you're getting in there. All the energy shots and stuff like that over the counter, I see people go for those. I don't think there's a lot of science behind those. I don't really buy into that. I think they're expensive. The best thing you can do is try and get the best sleep you can, when you can, and that's probably the best advice. It's easier said than done, but yeah.
Sure. I want to go back to something you touched on with those energy shots. I think the main ingredient, one of the most active ingredients, is B12, correct?
Correct.
A high dosage of B12. Is there anything related to B12 that gives you a burst of energy, be it short-term, be it sustained over a certain amount of hours?
I'm not really sure. I mean, people say they get energy for those. I typically, when I think of B vitamins, I don't think about energy. There's several B vitamins, and they're all water soluble. So, I mean, usually your body will absorb what it needs through the intestine and use it, and then the rest just is excreted in your urine.
Right.
So I'm not really sure how much energy rush people are getting from that. I've never really looked at all the contents completely on the energy drinks. I've seen people have bad side effects if they drink too many.
Sure.
Like they feel like their heart is racing. They get what we call palpitations. It makes them jittery and nervous. And then I typically tend to see that people crash kind of after they stop using those. I mean, they might get a burst of energy, but then they're in worse shape than when they started. And so, you know, I think healthy exercise, healthy diet, regular exercise, because it releases like the feel-good chemicals in your body like dopamine, and trying to get regular rest is probably the best medicine. So
very good. Doctor, we appreciate it as always.
Yeah, thank you.
Hey, we do this every Tuesday. If you've got a health question for one of the docs, you can post it on our Facebook page, but we do want to remind you that the advice in this segment doesn't replace the advice of your own doctor. If you're experiencing a health emergency, always call 911. We'll be right back.